Hello, friends. How are we doing? It's beautiful to have us back on the channel. It's been a while that we have been able to shoot and upload our videos. Work has been hectic for us. But thank you for those who have reached out to us, and we're happy to be back. Today, we're just discussing Ebola virus. What's Ebola virus? Ebola virus is a type of virus, that is in the family of auto Ebola virus. And they belong to a set of viruses that we refer to as the viruses that are able to cause what we call viral hemorrhagic fevers. Viral hemorrhagic fevers are a set of fevers that are caused by viruses, and these fevers usually lead to the victims of these illnesses bleeding from various orifices, various holes within their body, from their mouths, their nostrils, their anuses, their penile holes, and then vaginas, every area, everywhere there's a hole, the ears, the victims or sufferers of any of this kind of viral hemorrhagic fevers usually bleed from these orifices. And these include like your virus, your Nile virus, your Lassa fever virus, among many others. So, but today we are just looking at Ebola virus, and we're looking at it because in the Congo currently, country called Congo. You have a lot of people suffering from this virus at this point in time. In fact, it has been declared as a public health emergency by the WHO. So it's a really serious issue, and it's important to understand the virus. It's important to note that the virus has a very high case fatality ratio or rate, which means that out of the people who contract this virus, a very high number of them are killed. And recent figures are telling us that about 1,900 people have died of this virus in the Congo, making the virus a really deadly and dangerous virus. It's important to note that this virus is spread, through contact, skin to skin contact. Now, not sex, but skin touching skin, clothing, then in body fluids. When these body fluids are exposed and anyone gets in contact with them, this virus can be spread from person to person. And so it's important to be very careful with this virus. Even touching the body of a deceased person, somebody who died from this virus, can lead to the spread of this virus. There are many signs and symptoms of this virus. You have fever, you have malaise, you have weakness, you have bleeding from orifices, which doesn't happen in every patient, but it happens in quite a high percentage of the patients. And then you have many of all these other issues: sore throat, vomiting, severe headache, diarrhea. These are all issues that people who have this illness suffer from. For diagnosis? There are quite a number of ways to diagnose these illnesses. Usually samples are taken of saliva, other body fluids, blood, and then you can run ELISA, enzyme linked immunosorbent assays. You can run different types of PCRs. These are ways through which this virus can be identified in all every of these samples, and then such an individual can be diagnosed of the illness. Now, what's the treatment? The treatment is usually uh, care that involves supportive care. So intravenous fluid, your drips, your normal saline, your dextrose and glucose, all of that, and then um, you know antipyretic drugs and all other oxygen therapy, blood pressure support, and all of these are all the kinds of different ways through which this illness can be taken care of. This illness is particularly exacerbating and serious in the Congo because there are issues. First, there's armed conflict in the Congo, so it's difficult for public health officials and their workers to adequately take care of the situation in the middle of a war that is currently going on. And then the health infrastructure is quite weak in the country, and there's not enough personnel, there's not enough hospital, there's not enough qualified workers to deal with this issue, and is becoming more of a problem every day. Now, the particular Ebola type that we have in the Congo currently is the Bundibugyo strain of the virus, which is quite unique because it's different from all the other types of strains that they've had in the past that have caused different kinds of illnesses. So it's important to note there have been other different types of strains that have caused other kinds of emergency, but this particular one is not there. And it's important to know that there's no vaccine that is available and able to combat this particular infection. These are the issues that have to do with Ebola, and I hope that we are all careful. I hope that our different countries, work hard, the port health authorities, to make sure that this issue doesn't leave Congo and become an issue for other African countries and other countries of the world. Thank you for staying this long to listen to this video. Please like, share, subscribe, and do have a blessed day. Cheers.